Hello. This is an introductory video about quality improvements in healthcare. I'm Dr. Hamer, a clinical psychologist working with the Veterans Affairs Quality Scholars Program. This is an interdisciplinary training program that collaborates with national and international healthcare leaders. The goal of this program is to advance the clinical quality improvement skills of doctorally prepared scholars and leaders in the science of healthcare improvement. The 6 dimensions of healthcare quality require the use of unique and systematic strategies to improve healthcare services. Here, we'll focus on patient-centeredness. Specifically, we'll discuss the theory of patient-centeredness and practical ways for targeting this dimension of healthcare quality. Providing care centered on the needs and expectations of patients is a key attribute of healthcare quality. The patient-centered care model diverges from the disease-based approach to healthcare such that it targets determinants of health that include, but aren't limited to, the physical, emotional, mental, social, spiritual, and environmental influences that impact healthcare services. One of the most important features of patient-centered care is increasing the engagement of patients in their own healthcare through a shared decision-making process between patients and providers. There is now a preponderance of research showing that patient-centered care approaches improve patient health outcomes, increase patient satisfaction, and enhance healthcare-seeking behaviors and patient self-management. The National Academies of Medicine defines patient-centered care as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. There's data that compares international healthcare systems on several metrics, including patient-centered care. Here's a comparison of healthcare performance among 11 high-income countries. As you can see, some of these systems perform better than others with regard to patient engagement and patient preferences. Every healthcare professional's heard the language that advocates for the patient-centered provision of services and interventions. And even though the language used to convey this is different across systems of care, the core message of the languages is the same and aligned with the mission of reducing the burden of illness, injury, and disability, and improving the health and functioning of the people served. A mismatch between providers' understanding of patients' preferences for treatment and decision-making may lead to a patient feeling disrespected, unheard, experiencing a lower level of trust in healthcare providers, or becoming disengaged throughout the course of treatment. Put simply, not providing patient-centered care is linked to poor patient outcomes and treatment non-adherence. Patient-reported measures allow providers and systems of care to collect data to inform where improvements may be made. Areas for exploration include the patient experience, patient goals, the working alliance between patients and providers, and satisfaction. Although satisfaction is included in the measurement of patient-centeredness, this aspect should not be conflated with patient-centered care as outlined by the National Academies of Medicine. Patient satisfaction is only one part of patient-centered care and is a global rating of patients' assessments of their care. This is an issue because satisfaction does not specifically assess patients' experiences of care. As an example, let's consider a patient's perspective of healthcare quality. One way to ensure that the care you provide is aligned with this patient-centered approach is to solicit information from your patients during an actual clinical encounter. For instance, regarding patients' experiences of care, do your patients think that the care you provide is consistent with their own personal values and well-being? It's very useful to determine whether your patient's treatment goals have been developed collaboratively to the extent that they align with your patient's personal goals. Achieving patient-centeredness may require health systems redesign through intentional and iterative processes. These processes should target the dynamics of patient-clinician communication and decision-making to focus on patient-defined outcomes with scientific evidence and professional judgment informing treatment options and processes. In fee-for-service treatments, evidence and professional standards define outcomes with patient preferences informing the processes of care. Patient-centered communication, defined as a free flow between patients and clinicians about values and goals, as well as data and experiences relevant to clinical decisions, facilitates collaborative treatment plans that are personalized to achieve patient-oriented outcomes. A novel way to help mitigate issues with patient-centeredness is by establishing initiatives related to improving clinicians' understandings around the role of culture within healthcare systems. Here, we're talking about instituting efforts aimed at systematically enhancing cultural humility to understand one's own biases, values, and cultural assumptions, and the politics and institutional power dynamics latent within biomedical contexts. By teaching and fostering an organizational environment of critical self-reflection, we can be encouraged to recognize, critique, and challenge inherent biases within healthcare settings. The Department of Veterans Affairs Office of Patient-Centered Care and Cultural Transformation has done a particularly thorough job of developing a framework for patient-centered care and implementing its whole health system of care. This is an approach to healthcare with the express goal of transforming a national organization and culture of care into a system that begins with understanding veterans' life missions, aspirations, and purposes, or what matters most, and then provides care to improve veterans' overall health and well-being. Whole Health integrates peer-led personalized healthcare planning with the use of whole health coaches and well-being classes, as well as allopathic and complementary and integrative clinical care that focuses on veterans' goals and priorities. When implemented properly, providing patient-centered care benefits patients and healthcare systems alike. For instance, patients and families may perceive greater dignity and respect conveyed by their providers. As a result, systems may also observe enhanced patient and family participation throughout the healthcare process, including patients and families as active participants. By using patient-centered approaches helps providers, families, and teams gain accurate and unbiased information in a timely manner to provide effective care. Finally, because patient-centered care engages patients and families in a multitude of ways, this improves patient health outcomes and may inform policy and program development, implementation and evaluation, and facility design efforts related to quality. In summary, the primary goal of patient-centered care is to improve individual health outcomes, which isn't something that's particularly new or innovative. In fact, while you work to improve outcomes, you should be very intentional about making your treatment plan collaborative by aligning it with patients' values, goals, and preferences. Providers provide care for and treat whole patients who have diseases, and not simply diseases that exist in vacuums or laboratories. This approach requires a fundamental perspective shift regarding the balance of power in clinician-patient interactions. Focus on specific events or clinical encounters and patients' experiences of and satisfaction with such. Finally, include data from an array of patient-provider interactions with multiple team members across the care coordination process.